Hello, I'm Dr. Bob with R.L. Anderson Associates, and we are nursing education consultants. We're going to be visiting with you for the next few minutes about student success on NCLEX. And this is the first in the series on how to improve your NCLEX scores. Faculty is the key to success. This is the kind of the foundation and the starting block for all of what we're going to be talking about. It begins with the hiring of faculty. I get, having been a dean and in those various administrative roles, that sometimes you're just strapped to find someone to cover the classroom, or you may have a clinical need and you're scrambling. Many people that have clinical backgrounds are willing to teach, but they don't have the credentials. So it's like putting someone in the ICU without any experience. Academic settings require a very unique set of skill sets. So it's why it's so important that you have structured orientation for these new faculty. You onboard them in the most appropriate ways possible. I strongly encourage that all these faculty members have a mentor. And that mentor, a good person to have would be the course lead or some other senior faculty member that is open to being a mentor and willing to serve in that capacity, because they can then work with them on an ongoing basis to complete your various activities related to orientation. The most seasoned and experienced faculty, the most knowledgeable faculty are the ones you should assign to your critical courses, and those are fundamentals, your 2 med-surg courses, perhaps capstone, and pharmacology. These are the foundational courses that is very, very important for student success on NCLEX. Now, there should be a number of faculty development activities available for you as you're creating your faculty development plan. A number of the vendors that have major publications, textbooks, for example, or Elsevier, Lippincott, and so forth, they have free websites for faculty. Sometimes you are required to purchase their books to use a lot of the resources. Other times they have things open source. Kaplan, Hearst, ATI also have support services available. Again, some may be free, but a broader, I guess, library of sources comes with the purchasing of their products. The National Council for State Board of Nursing is another good site. They have a variety of free activities that faculty can use for the development. So take advantage of these as much as you can. As I said earlier, faculty development should be an integral part of your monthly faculty meetings. Time set aside, it's critical, particularly if you have a lot of new faculty, because this is going to be a key issue in improving your NCLEX success. Take advantage of your college and university faculty development office, because they may have a lot of resources to support you. Ensure all faculty support material is current. You probably have a system of where you go by and review and update material. Anything new, you may make an addendum or appendix to the existing handbook. Often these are electronic, and so it needs to be kept current. The new hires, as well as existing faculty, you'd be surprised how many existings are not familiar with what it says in the catalog or what the faculty handbook says or the student handbook. They may not have an orientation to nursing program accreditation requirements, depending on who you use for that. They should know what the criteria is, particularly those that relate to the faculty role. Or they also need to know about your systematic plan of evaluation, or whatever you are calling your comprehensive evaluation of your program within the school. After providing them this material and having some time to work with their mentor and reviewing all the information, the new hire should sign an acknowledgement form indicating that they have reviewed that information and keep that in their personnel file. Now, every faculty member should have their own development plan. Most accrediting agencies require this in their personnel file. They have to show, demonstrate that they've done continuing education. Some require 3 hours of CEUs per faculty on a quarterly basis. If you're not accredited to provide certified CEUs, then you may want to work with your state nurses association, perhaps a local hospital, or somebody else who will be the certifying agency for your official CEUs. And again, I mentioned the 30-minute sessions, and I'd alternate that by faculty members so they take ownership. A good suggestion I like to use anyway is use the Certified Nurse Educator review material as a basis of some of these offerings, as well as the NLN standards for nursing faculty. They can be very, very helpful to new faculty as well as your existing. And of course, you can bring in outside speakers, attendance at local and national conferences as funds allow, but probably your most cost-effective method if you want to have a more intense workshop, say a 6-hour or an 8-hour CEU activity, is bring in a consultant, because you can cover a lot of material in a very cost-effective way for the faculty to be up to date on what's going on in an academic year. So the plan needs to be signed and put in the personnel folder. There needs to be included in that an orientation to HESI or Kaplan or PERS or ATI, whatever you're using, so that they all understand the components of the integration of those resources in the curriculum. Clearly, they need to know about the course syllabus and what's included and what all the activities are. Your syllabus should include rubrics for any written assignments, and we can talk more about that in subsequent series about how to limit some of the non-objective material, because having too much can really impact NCLEX preparation. I'm a big component of standardized lesson plans. Many of these publishers will help provide those for you, or they have them available already, and you can modify them, and you can be assured that all domains of learning are covered. And it's also pertinent to the didactic and to the laboratory, the simulation, and then what happens in the clinical setting, all totally integrated. So lesson plans provide consistency, and you ensure that every faculty member is teaching the content in a way that's going to be meaningful and useful. As I'm talking about the vendor products, often they have specialty tests, and if you're using them, the faculty need to know how they're incorporated into the curriculum and into testing. And if you use any component of them for a final course grade, or even a portion of the course grade, they need to know what the conversion score and how to do that. Case studies are highly recommended for use in the curriculum. New faculty need to understand the case study, how to teach using a case study. If it's a homework assignment and they come to class to discuss it, if it's an in-class small group activity, and of course how to assess it. Simulation is obviously very important, and almost all states now, with the exception of a few, allow simulation into the curriculum. And so most places have dedicated staff that can use a variety of simulation cases to facilitate student learning in a safe environment and provide the ongoing evaluation and support to students. If you don't have a dedicated staff, it gets a bit more complicated, because then whoever's managing simulations in a particular course need to know how to use it. Simulation should also include the use of electronic health records. As you know, that is the standard requirement now in all of our acute care facilities and most clinics. So they need to know how to do that. There's a variety of softwares available that you can use to do that. And lastly, probably one of the most important pieces is how to write an appropriate NCLEX style exam. It needs to follow a test plan, and there needs to be a comprehensive test plan for the entire curriculum and by course. It needs to have appropriate cognitive domains and analysis and etc. This is pretty complicated stuff for new faculty, even for existing faculty. Do not use publisher textbooks, test banks, because they're not valid, because of they're often available to the students on the internet, and they may not be written appropriately. In my experience, the best way of doing this is bringing in an on-site consultant who can work with you on how to do this. And typically those are 6 to 8 hour workshops, which include hands-on activities, and then you can have follow-up activities as necessary afterwards, perhaps if you're going to create a test bank. So managing your faculty, and this is for the administrators, you need to routinely visit your classrooms. Ask yourself, if I was paying $35,000 or whatever it is it costs to attend your school for a year or for the program to the school, am I getting the value expected? So that's the kind of question you need to ask when you go in and visit the classroom and actually observe what's going on. Act quickly and poor performing faculty. This is a huge error that often administrators don't address timely. If someone's not doing their job, it is going to markedly impact your NCLEX success. So it's like having a rotten apple in the barrel that will certainly spoil the whole thing, and pretty soon you'll have no apples. In this case, you'll have very poor performance on the NCLEX in the areas in which these poor performing faculty are teaching. Put them on the improvement plan and then dismiss quickly if not meeting the job expectations, following your HR guidelines and how you can do that. Obviously, if you know someone that's probably not going to make it, you should be looking for someone to replace them and figure out a backup plan. Simply keeping them in there because you can't find anybody is a very poor decision. Tenure and tenure track faculty performance issues are a little bit more challenging. You work with your provost or chancellor on that. It also would be probably useful to work with one of the consultants who have a lot of experience in senior leadership and how to manage these situations from a practical perspective. So if you're thinking about hiring someone, get right on it. It's a very competitive marketplace. And be on top of your compensation, because others will undercut you very quickly. Focus on the long-term needs. In summary, as you can see from my brief presentation, there's a lot that goes into this foundational support of NCLEX success, which is faculty and faculty competency. It takes a team to make this happen. Don't lose sight of the big picture when dealing with day-to-day operational issues, because without a solid faculty foundation, your chances of improving NCLEX will be very, 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 very difficult. Be efficient in time management, and remember the Ronald Reagan concept of trust and verify. This is like going into the classroom and all those types of things. Student success is a direct reflection on faculty leadership. Now, if you have more questions or you want a dialogue, give me a call or send me an email. I'd be more than happy to discuss these issues with you. Best of luck to you. Look forward now to my next series, which will be forthcoming in the near future, on other strategies for NCLEX success.